The World Health Organization on Wednesday declared coronavirus disease a pandemic, and the Tourism and Hospitality Association of Guyana says the tourism industry could potentially face a shutdown locally and internationally. Expounding on the impact that the COVID-19 has had on the local tourism sector to date, President of the Tourism and Hospitality Association of Guyana, Mr. Ram Kumar, told Nightly News that 2 tour operators have confirmed a number of cancellations. He lamented that all of this is coming at a time when Guyana is now firmly on the global tourism radar, having won a number of awards over the last year.
As you know, people are more hesitant to travel, and there are certain countries that have barriers depending on where you visit and so on. But the COVID-19 has really it has spread. And as you know, we had the case in Jamaica, so it's actually spreading in our region. And so it's going to have a negative effect on travel. And travel it's linked to tourism.
The Caribbean Public Health Agency, CARPHA, has raised the risk level in the region from low to moderate to high. Regional governments continue to focus on preventative measures, including mandatory quarantine procedures or other restrictions for travelers arriving from China and other affected countries. Noting that TAG is playing its part in ensuring the dissemination of education and awareness of the virus, the president said that local hotels and guest houses have instituted the Regional Tourism and Health Program, which is aimed at improving the health and safety of locals and visitors for a healthier, safer tourism experience.
What the employees are required to do through this program is to report any symptoms that have been displayed by their guests. And so the coronavirus really is a threat to the industry. And this is why we have this program, the CARPHA program, because an illness like this could actually shut down the industry. People could stop traveling. We've already been experiencing some amount of cancellation because of this coronavirus, COVID-19.
A 52-year-old woman who died at the Georgetown Public Hospital on Wednesday morning after being rushed there on Tuesday night with a respiratory condition has triggered tests for the coronavirus in Guyana. Ram Kumar added his voice to calls for proper hygienic practices.
Take preventative measures. Ensure that your staff is protected, that they are aware, because the knowledge is power. In this case, it could save your life. And so if you are aware of what to look for, the fever symptoms, coughing, sneezing, any sort of respiratory challenge that you would notice in someone, it needs to be reported immediately. I would also want them to be vigilant, not only to guests, but to the employees, people that are in offices. So, in enclosed environments, the disease is also, it can spread very rapidly.
Reporting for HGP Nightly News, I am Yanis Abrams.